Welcome to our channel. Today we'll explore Pelacarsen, a groundbreaking investigational drug designed to lower lipoprotein A, or LPA, a major risk factor for heart attacks and strokes that often goes untreated. Let's dive into its origin, chemistry, how it works, and its promising clinical benefits. Pelacarsen was originally developed by Ionis Pharmaceuticals under the code name Axia ApoA LRX, or TOJ230. In 2019, Novartis acquired global rights for its late-stage development and commercialization. This makes Pelacarsen the first-in-class therapy that directly lowers elevated LPA, a genetically inherited lipid that isn't affected by statins or most cholesterol drugs. So how does it work? Pelacarsen is a second-generation antisense oligonucleotide, or ASO. It's chemically linked with a triantennary GalNAc ligand, which helps it target the liver more precisely, where LPA is produced. Once administered, Pelacarsen binds specifically to ApoA mRNA in liver cells. This binding triggers RNase H1 to degrade the mRNA, preventing production of the ApoA protein. As a result, LPA levels in the bloodstream drop dramatically, by up to 80% from baseline. Let's talk about what happens inside the body. Pelacarsen is given as a subcutaneous injection, usually in the abdomen, thigh, or upper arm. It's absorbed into tiny blood vessels and reaches peak levels in the blood in 3-4 hours. It binds moderately to plasma proteins, but thanks to the GalNAc ligand, it's selectively taken up by liver cells. Inside the body, nucleuses break Pelacarsen down into smaller, inactive fragments. These are processed mainly in the liver and kidneys, and are mostly excreted through urine. It has a long half-life of about 30 to 50 days, which means dosing can be once monthly. Pharmacodynamically, Pelacarsen's main effect is on LPA, cutting levels by up to 80%, often within weeks. It has minimal impact on LDL, HDL, or triglycerides, but may slightly lower CRP, an inflammatory marker. Higher doses yield greater reductions, and the effect is sustained with continued treatment. So where might Pelacarsen help patients? In atherosclerotic cardiovascular disease to lower the risk of heart attacks and strokes. In coronary artery disease, it helps reduce plaque buildup and recurrent cardiac events. It may also benefit those with ischemic strokes and peripheral artery disease by improving circulation and reducing clot risk. Additionally, it could slow calcific aortic stenosis and might protect cardiovascular health in chronic kidney disease. It's even seen as a potential alternative to apheresis, reducing the need for invasive procedures to remove LPA. What about safety? Pelacarsen is generally well tolerated. Some may have mild injection site reactions like redness or swelling or flu-like symptoms. A slight increase in UTIs has been noted, 13% compared to 6% with placebo. Crucially, no serious organ toxicity or adverse effects have been observed. Pelacarsen represents an exciting step forward in treating high LPA, a long-overlooked risk factor for cardiovascular disease. If you found this helpful, like and subscribe for more clear, science-backed videos. Thanks for watching.